Good afternoon, and thank you for being with us at our what once was a daily 2:30 press conference. We haven't been here for a couple of weeks, and so it is good to be back and give everyone an opportunity to talk about where we find ourselves. But before I do that, I do want to take a personal point of privilege and thank the people of Mississippi for all of your prayers, your encouragement, and your support. I believe in the power of prayer, and I can tell you with certainty that I felt your prayers. I can't tell you how many of you reached out to me on social media platforms, through text, through emails, to my main number, through phone calls to our office, and I can say with certainty it has made a difference, and I want to thank you from the bottom of my heart for all of those prayers and encouragement and support. I also want to take this opportunity on November the 24th of 2020 and wish my bride a happy anniversary. We were married 19 years ago today. Literally 15 months after our wedding day, I declared to be a candidate for public office, one of those things that we had not talked about before it just spontaneously occurred. But Ely is a fantastic First Lady. She's an even better mom and wife, and I'm proud to have her by my side through these challenging times. When we said for better or worse, I'm not sure that we contemplated that COVID-19 would occur, but she has been a rock for our family, and so happy anniversary, Ely. We're here today to talk about COVID-19. COVID-19 is not going away. It's not going to just disappear. In fact, across the country, it appears to be getting even worse. Mississippi has been able to avoid the national surge in cases for a while. We had seen 7 or 8 weeks of slow but steady but small increases in overall cases. However, now it's clear that we are in the middle of our second surge. If you look at our numbers, while we have not yet returned to the height of the pandemic, where we were in late July 26th, where we had 1,392 cases on a 7-day average. If you don't include today's number, which was a little bit lower than what we've seen on most Tuesdays dating back for the last 3 months, we have seen a 7-day average that has reached the level of just under 1,300 cases per day over a 7-day average. If you look at our hospitalizations, we are continuing to trend upward. Yet again, not where we were at the peak. If you look at both confirmed plus suspected cases, we peaked in August at around 1,250 cases. Today, we find ourselves, if you add those two numbers, at 1,040 cases hospitalized. If you look at ICU patients, we peaked at 337. Today we have 224 patients in the ICU. If you look at ventilators, we peaked a little over 200 cases. Today we have 107 on ventilators. But what we know is that hospitalizations tend to lag total number of cases. As we looked at this throughout this pandemic, somewhere between 15% of cases end up in the hospital. So as we've seen these large numbers over the last 10 days to 2 weeks, we know that our hospitalizations, even if the total number of cases were to flatten or hopefully decline, our hospitalizations will likely continue to rise over the next week to 2 weeks. And so we have to be careful, we have to be diligent, and we have to take action. As we have done since June, we continue to monitor the data and make decisions accordingly. Today, we have more counties that qualify for additional measures, including mask mandates in these individual counties. In total, there will be 19 added today. Alcorn, Attala, Bolivar, Chickasaw, Choctaw, Jeff Davis, Jones, Lafayette, Lawrence, Lincoln, Lowndes, Neshoba, Panola, Perry, Prentiss, Stone, Tippah County, Tishomingo County, and Union County will be added. You may recall several weeks ago, we initially started with 15 counties with additional restrictions. 2 weeks ago, we added 7. So with the addition of these 19 counties, we will now have 41 of our 82 counties under additional restrictions. To be fair, there are 4 of those original 22 counties that no longer technically meet the criteria. I have made the decision that we will leave those 4 on with these additional restrictions for at least another week. All of them, while they fell under our very objective criteria, fell under it by a relatively small margin. For instance, Lamar County, the largest of the 4, is now below 200 cases over the last 2 weeks, but they're somewhere around 194 or 195. And so it seems to me to make sense that even though they're slightly under the objective criteria, that at least for another week, we leave them on and see what happens. As we go into Thanksgiving, just 2 weeks from today, we have much to be thankful for. But we also have a duty and an obligation to be smart. This is a critical time. Please be extra cautious, and please look out for your loved ones. There is much more COVID-19 around us. There is much more in our communities, and therefore there is a greater risk that you may unknowingly pass the virus to someone that you love dearly. So I'm strongly encouraging my fellow Mississippians as we go into Thanksgiving, a day that we all look forward to spend with our family. And we all know that in 2020, as difficult as it's been with the isolations and the quarantines and staying away from anyone for 14 days here and there, how much we are all looking forward to seeing our family. The facts are that it is risky. I'm not going to stand up here and tell you you can't do it, because each Mississippian has to step up and make their own decisions. But I will tell you that the risk is greater today than it has been at any time since August. I will tell you with certainty that social gatherings in and around Halloween has helped contribute to where we find ourselves today. There is more virus in our state when we're seeing 7,000, 8,000, and 9,000 cases per week than there is when we're seeing 3,000 and 4,000 cases per week, as we saw 6 weeks ago. That means the risk is higher. The risk is greater. And I can tell you with certainty that there are many positive cases, some of which have been detected, some of which have not, in which the symptoms are not very much. And so because of that, it behooves all of us to be smart as we go into Thanksgiving. I did do a call yesterday with Secretary Azar and the leaders of HHS, and I just want to give you a very brief update that there is more positive news coming out regarding the vaccine. According to the data that we received yesterday, we all know that both Pfizer and Moderna's trials have reached a point at which they've made the results public. Both vaccines have an approximate 95% efficacy rate. It is believed that both vaccines are very safe. Now, they are currently will go through the CDC and FDA process. They will be peer-reviewed to confirm that they are indeed safe. But assuming that occurs and that they receive emergency authorization, it is possible that in America we could receive up to 22.5 million doses of the Pfizer vaccine by the end of December and 15 million doses of the Moderna vaccine by the end of December. That's 37.5 million doses before the end of this calendar year. I want to just mention that, and Dr. Dobbs, correct me if I'm wrong, but my understanding is that both of these are going to be a multi-dose vaccine. It's going to require at least 2 shots to be fully vaccinated. And my impression from the call yesterday is that these 2 shots must take place about 3 weeks apart. And so even if we get the first round of vaccines in the middle of December, that doesn't mean that we can all go back to normal before Christmas. And so keep that in mind, as this is a multi-dose vaccine, and that it's going to require a little bit of time to get a large number of our fellow Mississippians with that particular medicine. The other thing I'll tell you, there's been a lot of conversation and discussion and maybe even some unwarranted criticism regarding the distribution of these vaccines. I want to assure the people of Mississippi that the distribution will be done appropriately. It will be done the right way. In fact, it will be done the way in which the Department of Health and I ask the federal government to distribute it. It is going to be a decision made by executive leadership at the state level as to what our priorities are. Dr. Dobbs and I have had multiple conversations about that, and we as a state are well on our way towards having a distribution plan in place. The other thing I'll tell you, the Pfizer vaccine is going to be distributed by Pfizer because it does require it being stored at extremely low temperatures. The Moderna vaccine will be distributed utilizing a contract that is already in existence between the CDC and McKesson. And just for those of you in Mississippi like myself who are pretty daggum proud to be a Mississippian, I want you to know that McKesson will distribute this vaccine out of 4 facilities in America, 2 in and around Louisville, Kentucky, and 2 in and around Olive Branch, Mississippi. And so over 1,000 of our fellow Mississippians will be involved and engaged in the distribution of the Moderna vaccine, and I have full confidence, just as they do with 80 million vaccines a year already distributed by the CDC, that this distribution process will be done fair. It will be done in such a way to get this out to the people of our state and our country as quickly as humanly possible. I know that I can't wait to have access to it, and I will be excited as soon as the trials are completed and the safety measures are in place and approved by the various agencies to take it as soon as is appropriate. Until that time comes, however, we have to bridge the gap. There is light at the end of the tunnel. There is a vaccine on the way. Because of Operation Warp Speed, this vaccine was developed in record time. It will be distributed in record time, but it's not going to be distributed tomorrow, and it certainly wasn't distributed yesterday. Therefore, our current position must be to bridge the gap from now to when that vaccine becomes readily available for the American people. As we move into Thanksgiving 2 days from today, please be safe. Please be smart. Wear a mask. Please do not take unnecessary risk. Look after your loved ones and keep them safe as well. This is a tough time. I know that people are tired of even hearing about the coronavirus. I particularly know you're tired of sacrificing and ready just to get back to life as normal. But we also know that God tells us that He does not give us more than we can handle. He called all of us to live in this time and to be a part of this mission. We all have a role to play. I know that we can, and I know that we will get through this together. At this time, I'm going to turn it over to Dr. Dobbs to give us an update.
Thank you very much, Governor. Today we're reporting 665 new cases and sadly a large number of deaths, 53 new deaths. I do need to let you know that 665 is going to be an undercount for today. There have been some transmission lags from some of the hospital partners through the electronic lab reporting, so expect that number sadly to increase as well. Our total number of deaths stands at 140 cases stands at 144,544 and 3,729 deaths. Obviously, we've been severely impacted by this virus. If we look at our total excess deaths in the state of Mississippi, since all this started, we have 5,090 more deaths than would have been predicted based on previous year's estimates. So clearly, we feel like this is an undercount of the number of deaths that we've had. And for perspective, this is about 18% more deaths than we would see on a normal year. So of all the deaths that we've had, we've increased almost by a fifth from the coronavirus, and that's only since really March and April, so it's not even a whole year. So it is a serious threat, and I want us to take it seriously as we go into this holiday. If we look at how different age groups are impacted, we've seen a lot of kids, and unfortunately we've seen a lot of cases among school kids and transmission in school environments, but we do know that kids and young adults get over it reasonably well. There are sadly some bad events, but by and large they recover quite nicely. But as we think about going into the Thanksgiving holiday, what about other age groups? If you're between the age of 50 and 64, our mortality rate has been 2.3%. 2.3% of those diagnosed with coronavirus have died in this age group. That is way, way higher than we ever can see with influenza. If we look at those between 65 and 69, 6% have died. Between 70 and 79, 10% have died. And between 80 and 89, 18%, and over 90, there's a 27% chance of dying from coronavirus of those who've been diagnosed with it. And the reason I bring this kind of up at this point is, as we're going into Thanksgiving, we're going to be mixing young folks who get over it by and large quite nicely with middle-aged folks like me and older folks who they love. And it's a really dangerous time for us to spread the coronavirus. It's extremely important for everyone to realize that you don't have to be feeling symptoms of coronavirus to spread it. Or we've seen multiple super spreader outbreaks where someone said, I just had a sinus infection, or this is just allergies, right? Not only do we need to be very cautious, but if you have any symptoms that could be coronavirus, you may have coronavirus, even if it's just nausea. We know some people have very limited symptoms. So as we go into this holiday season, want to really reinforce how important it is, the CDC guidance, right? We want to keep it small, want to keep it primarily within nuclear families and local. And I'll add, especially in Mississippi where the weather's not too bad, do it outdoors. It's much, much safer to have your social gatherings outdoors. So please keep it small. If we jump to the hospitalizations, the governor did go over the hospital numbers. Our counts have been rising, as he had mentioned. If we look at the Jackson area, we see that there is only one hospital that has ICU beds available. Still, we're feeling a lot of pressure on that front. And then in DeSoto County, where we know we've seen a lot of cases, there are 0 ICU beds in our Mississippi hospitals, at least in DeSoto County. On a happier side, if we look at the vaccines, we do have 3 vaccines that look very promising. We have Pfizer, the Moderna, and the AstraZeneca. Pfizer did submit emergency use authorization request to FDA, and we know that they have it on the schedule to be reviewed by their advisory committee on December 10th. And depending on how that goes, a vaccine may be available to us in small numbers in relatively short order following that. Additionally, we have some new therapeutics available to us. One of them is bamlanivimab, which is a monoclonal antibody by Eli Lilly. And we do have that product has been delivered to Mississippi, and 92 Mississippians have thus far received this product through their hospitals and health systems. We also anticipate getting more of this, but also Regeneron's antibody product that the President received will also be available in the near future. The only thing that I would like to just to close with is I do want to remind everyone how important it is if you are diagnosed with coronavirus, you have to isolate at home. There is a legally binding public health order that if you are contagious with coronavirus, you have to stay home away from work for 10 days, right? I think most of us know that. We did add to this last week that if you are the family member of somebody who has coronavirus, if you live in the same household, you need to quarantine. Now, quarantine is less restrictive than isolation. You can go to work under certain special circumstances, but you cannot go to social events, you can't go to parties, you can't go shopping. If you live in the household of somebody who has been diagnosed with coronavirus, you must quarantine. It's so very important if we want to turn this around, and this also is a public health order. But please go to our website if you need the details on the quarantine and what that entails. And Governor, that's all I have today. Thank you, sir.
Thank you, Dr. Dobbs. Just so you know, the weather on Thursday, low of 55, high of 73. I'm certainly not a weatherman. Those of you here on representing TV stations certainly have weathermen and women that can confirm that, but if the temperature gets to 73 and sunny on Thanksgiving Day, that certainly lends itself to an outdoor gathering rather than an indoor gathering. And so I encourage you to keep the numbers low if at all possible, and do it outdoors if at all possible as well. At this time, I'm going to turn it over to Director Michelle. Greg?
Thank you, Governor. Good afternoon, everyone. Just give you an update on a few things. Obviously, with the spike in our COVID cases, our PPE deliveries have increased as well. We've basically doubled from what we had over the last couple of weeks. Deliveries that went out today, we had 32 Tier 1 site deliveries, and then yesterday we had 33. So 65 over the last 48 hours deliveries getting PPE out. We are in good shape with PPE. We set ourselves up to make sure we have been preparing for this spike this time of the year. Unfortunately, we are seeing it, but we do have PPE, and we'll continue to be able to support those Tier 1 facilities as they need. Just an update from Hurricane Zeta. We have completed damage estimates from Hurricane Zeta. We had significant damage from that storm. It was isolated in a few of our southern counties. We have a deadline as for Friday to get our damage estimates in to FEMA. The governor is looking at that. His governor's attorney is looking at that information now. We will get that in prior to that deadline. This will be a major federal declaration request. It would include individual assistance as well as public assistance, and also a small business administration declaration. For individual assistance, we were looking at about $10 million worth of damage to homes in George, Greene, Hancock, Harrison, Jackson, and Stone counties. And then for public assistance, we are at, and it is still growing, about $79 million worth of damage to public infrastructure there, and that is growing. We will be requesting public assistance declarations for George, Greene, Hancock, Harrison, Jackson, Perry, Stone, and Wayne counties there. And then for the small business administration assistance, the counties will be George, Greene, Hancock, Harrison, Jackson, and Stone. Now, I want to be real clear. That does not mean that other counties could not be added as we get damage assessments there. So if your county was not mentioned just now and you had damages there, it just means that we're still calculating some damage. We will be able to add counties should counties meet the thresholds there. So we'll be sending that forward, and this will be probably sometime after Christmas before we get a word back on that, but we do anticipate a favorable response on public assistance. Individual assistance is always very subjective, so we will keep you posted as we move forward there. Finally, the governor had already referenced about the changing in weather coming about for Thanksgiving. Tomorrow we do have a cold front that's going to be moving through. It is not anticipated to be anything major, but there is marginal risk for severe weather, and anytime we get a cold front coming in, there's always the possibility of tornadic outbreak. So just be mindful. This is a pretty fast-moving storm, so hopefully it'll be out of here by late tomorrow afternoon, evening. Other than that, subject to your questions, Governor, that concludes my update.
Thank you, Director Michelle, and as I have tried to do repeatedly throughout 2020. I do want to again thank the men and women who work at the Mississippi Department of Health and the men and women who work at the Mississippi Emergency Management Agency, as well as the men and women who work on my staff and throughout state government that have been working literally around the clock. This hadn't been an 8 to 5, 40-hour a week job in any of 2020. I'm not sure it ever has been, but it certainly hadn't been in 2020. And there are a lot of good people, good Mississippians that are working hard every single day. And on this week of Thanksgiving, I am personally thankful for their efforts, and I know that I echo and speak on behalf of all 3 million of my fellow Mississippians how much we appreciate what everyone is doing to make sure that we provide the data and the information that you all need. And then I also want to thank our friends in the media who have done by and large, a good job of getting that information out. So with that, I'm going to open the floor to questions. Scott, I think your hand went up first.
Solid job with the weather forecasting, by the way, you and Greg. 41 of 92 counties are now under this mask mandate. We've heard from healthcare leaders, even lawmakers, asking for a statewide mask mandate. City of Vicksburg is doing a mask mandate through Thanksgiving. Why not do a statewide mask mandate now?
Well, Scott, what I would say to you is that my view is this notion of a mask mandate has really become a buzzword in this fight against COVID. It's a buzzword not unlike the buzzwords that we started hearing back in March. You know, it was in early March, it was all about ventilators, ventilators, ventilators. And then it was 2 weeks to slow the spread. And then it was about lockdowns. And then it was about shelter in place. And then it was about closing bars and then closing non-essential businesses. And lately, all we've heard is mask mandates statewide mask mandates. And the fact of the matter is that none of those actions taken by themselves is a panacea. None of them are a silver bullet. In fact, I believe, and by the way, I have issued a statewide mask mandate when I believed it was in the best interest of our citizens to do so. I'm not scared to do so again. I'm not scared to put a mask mandate on an individual county. But wherein some of our friends, I believe, have missed the mark is there are those who believe that if the governor writes those words down on a sheet of paper, statewide mask mandate, that it's going to lead to some tremendous outcome. The fact is, Scott, that it's not about the words on the page. It's about what are you as a governor and as a leader doing to convince as many people as you possibly can to do the right thing and wear a mask. I don't think a statewide mask mandate ensures that a higher percentage of the people in our state, particularly in those areas where the virus is most prominent and where the community spread is the greatest, I don't know that a statewide mask mandate, in fact, I believe that a statewide mask mandate that is then left in place for months and months on end is the best policy. I believe, as I've said for the last 6 months, and quite frankly, I think the data is very clear and proves my point, that if you issue the mask mandates on a county-by-county basis based upon where the number of cases is the largest, then that is the best strategy to convince the most number of our fellow Mississippians to wear a mask. I do not believe that it is debatable at this time as to whether wearing a mask or not is helpful. I believe the data is clear. I believe that the analysis is clear. Wearing a mask helps slow the spread of the virus. The question then becomes, what is the best way in which to convince the largest percentage of Mississippians to wear a mask? I believe a county-by-county approach in those areas where it is most needed is the way to do that. And that's the reason we've had a very objective criteria. It's the same criteria today as it was 6 months ago, and we're adding 19 counties because they have crossed that threshold. What do you have?
Governor, you talked about Thanksgiving, and you did talk about the risk involved, but by the same token, you said that you weren't going to sit there and tell people that they can't get together. how is this different than back in the spring when you talked to church leaders and said, hey, there is such a risk, I am pleading with you not to meet? How is that different than not today asking families, I'm pleading with you not to meet outside of your nuclear family,
You know,
as Dr. Dodd says?
honestly, Courtney, and I don't think it is a lot different. My message is the same to families today as it was to church leaders months ago, and that is this: if you have a large gathering with a large number of people, it is higher risk, and there are ways to do it safer. There are ways to do it less safe. If you get 30 people indoors around a small table in your grandmother's house, as the Reeves family loved to do for years and years and years, until my sweet grandmother passed away a couple of years ago, at the ripe old age of 100, by the way, that's a lot higher risk than if you have individually plated lunches and there's 5 or 6 of you and you're sitting outdoors and you're sitting fairly far apart.
But you won't go hard to ask that it be nuclear families only, as we've heard from Dr. Dodd and healthcare leaders?
Well, I think there's no doubt that nuclear families would be helpful. The more you limit it, the better. So, excuse me. Yes, sir.
What's the key difference in the data right now compared to early August when you did issue a statewide mask mandate? Because right now, we're seeing, I think, as you mentioned, maybe around 200 more cases average a day than when you issued that in early August. And as you mentioned, hospitalizations are delayed. We've heard some concerns from health leaders about that.
So if you'll remember, in early August, we did county by county measures for the bulk of late June, all of July, and early August. We got up to having 38 counties under a county-wide mask mandate. Today, we went from 22, we increased by 19, so now we have 41 counties. And what we saw when we ultimately made the decision to go to a statewide mask mandate is that we were going to be adding even more counties above that 38 number, and it made sense at that point that we had reached that threshold where the community spread was so wide in a large, well over half of our counties, and that's why we made that decision. And so we're continuing to monitor the data. I will continue to argue, and I think the data is very clear, that if you were to just go in and set a statewide mask mandate, as many of these same folks who are calling on me to do today, they've been calling on me to do it for months and months and months and months. I will tell you, it is clear to me, if you look at the data in our state relative to virtually every other state out there that has done that our approach has worked much better than it has in other states. But I will tell you that we continue to monitor the data, and as I have said repeatedly throughout this, I don't rule anything out. There is a possibility that if numbers continue to go up, that we will issue an order at some point in the future. Gerald.
I guess, Governor, what is that number or that tipping point to where you strongly consider putting a statewide mask mandate?
I don't think, Gerald, that there is a specific number that would guarantee it, but I will tell you that it is always under consideration, and at the point at which I believe that it will help us get more of our fellow Mississippians wearing a mask is exactly the point at which I will issue further restrictions.
Several school districts have sent the kids home to learn remotely going into Thanksgiving holiday. I realize this is one of those would you consider this questions. But do you think it's a possibility that the schools could remain out or should remain out through Christmas break to stem this rise in case count?
Again, if the question begins with would you consider, the answer is yes. I do not believe that I think there are a number of school districts that went remote in a week before the Thanksgiving break. Most schools are out for the entire week of Thanksgiving. I think there were school districts that went remote for most of the week before. There are other schools or school districts that went remote for 2 weeks prior to. I believe that next Monday that schools should reopen. If you listen, which I have done repeatedly by Dr. Redfield at the CDC, the risk to kids not being in the classroom, in his opinion, and it's an opinion that I share strongly, the risk to kids in Mississippi not being in the classroom is greater than the risk to kids for being in the classroom. When you look at the transmission in our schools, particularly in August and September and most of October, what we find is those schools that shut down, while there was certainly transmission in the classroom, the vast majority of it was initiated at social activities, much of which centered around Halloween. That's really when this wave that we find ourselves in today truly began, in my mind. We're about 3+ weeks beyond that now, 3.5 weeks beyond that. So the numbers we're seeing today is sort of that second wave where a lot of the kids got it. They have given it to others, oftentimes unknowingly. But I believe after this break of Thanksgiving, we would be better served and the kids would be better served if we focused on in-person, in the classroom learning and did significantly less social activities.
They're in class that they're wearing their mask. That's required. Do you believe the statewide mask order would just make people not want to do it? They get tired of it because, the kids have to wear the mask inside the schools.
Yes, it is a requirement that kids wear masks in the classroom, and I think, based upon anecdotal evidence, can't quantify this, but I think the vast majority of kids are wearing a mask the vast majority of the time when in the classroom. Now, they also have to eat lunch, and so when they eat lunch, oftentimes, obviously you can't eat through a mask, and so you take it off, and so there are times when it becomes a little bit more risky, no question, but I think we have proven over almost 15, 16-week period for most schools that we can do it in a relatively responsible and safe environment. There are risks, but there are going to be risks to most anything that we do. Yes, ma'am.
Dr. Dobbs, you mentioned about the isolation orders and the quarantining. Are you all having issues with that? Are you getting reports that people who are under isolation orders are getting back out into the community?
So sometimes on the isolation piece, not quite so often. People who have it recognize pretty clearly by and large they need to stay home. So for the quarantine piece, right, for households, if you live in the household with someone else, your odds of getting coronavirus are extremely high, maybe around 40%. So that's super high. So we know you're a high-risk target for infecting other people when you don't realize it. So it's a really important group to go ahead and know, yes, I need to go ahead and quarantine before the health department calls me. But the other part of it is with the increasing case burden and also just we don't get a hold of everybody, just, sometimes phones are out and that sort of thing. We want to go ahead and say, hey, look, it's your responsibility to quarantine because you are the next link in that chain. You're going to cause the next family to get infected. So it's time for you to take those measures. It doesn't mean we encourage people to work from home and stuff when they're quarantined, but there are certain circumstances where people have to do stuff and there's special measures you can take. I believe that the masks work and personally, I know that I've been exposed to dozens of people within very close proximity throughout this whole time. And what's protected me is this and a face shield or just this even. So I do know that it's helpful, and then also the outdoors piece. So it's important. But the other thing, I hate to change topics, but masks only work when you wear them. And people don't wear masks around their family. People are just not going to wear masks over Thanksgiving, I don't think. I mean, some may, and that's fantastic. So that's why it's important for us to be careful and do the outdoors in small groups and that sort of thing. Because what we've seen over and over again is that masks don't work when you eat, and masks don't work around your family. And so that's why it's important, especially right now, for us to, the mask is important, but let's really focus on the groups and the social right now. That's what's driving it. People are catching it from their friends and their family, and those are the people they don't wear masks around.
And I just want to add one thing to that. I've had the occasion over the last 15 to 16 weeks to talk to a lot of school administrators, and to your question, they don't have much trouble with parents whose kids test positive. They understand that it's 14-day quarantine or whatever their school policy is. They get it. But you go to that next level where they contact trace and they identify the kids that have been in close contact as defined by 15 minutes without wearing a mask. And there's a lot of pushback by parents at that point, and understandably so, but that's how you really slow the spread, and that's how you ensure that schools can stay open, is to get that second layer of those that have been close. So, yes, ma'am.
This is a question about long-term care facilities for you, Dr. Dobbs. So it's been reported that Mississippi tops the nation's COVID-19 cases in nursing homes, where half of all residents have contracted the virus. Can we have an update on what's happening in our nursing homes? How is the reporting being handled? Are there any concerns there, any inconsistencies? As well as what would you attribute to the spread in our nursing homes?
Yeah, certainly nursing homes have been severely impacted. As a proportion of deaths, it hasn't been as high as some other places for sure, but yeah, it's a vulnerable place. We know we have people in close proximity to one another, and it's been a super challenge. We do continue to report on our nursing home cases, and we're monitoring that very closely. But as the cases have increased, also our nursing home outbreaks have increased. That's not remotely surprising. Nursing home activity reflects community transmission. And then, we have a lot of challenges with, employees, working multiple locations, and, and a lot of employees may not be symptomatic, or they may be minimally symptomatic going to work, and so it's a real challenge. The other piece about this is very important. We are doing a lot of testing, but we know testing is not an absolute barrier. Okay, it's very often that people get a rapid test and they're negative and they're still contagious because they don't have symptoms. The rapid tests don't work that well if you're not symptomatic. Or you're maybe early in your infectious period, and then if you're checked once a week, you go to work that next week, and for that whole next week, that's when you're most contagious. So it's a really challenging environment. We'll have to continue to, devote many resources. We do outbreak testing, a lot. We do infection control work with them a lot, both from our epidemiologists and our licensure folks. It's a huge challenge. There's just no doubt about it. And we'll just have to continue. Going into the Thanksgiving, we are strongly encouraging people not to bring their loved ones home for Thanksgiving. Pay them a visit carefully. We do have it where every nursing home can do outdoor visitation, even if they're in an outbreak. But if they're in an outbreak, obviously you can't go inside. And if they're not in an outbreak, there should be opportunities to have carefully choreographed visits.
Yes, ma'am.
We've got Leah Willingham with the Associated Press.
Great.
Leah, are you there?
Yes, I'm here. This is a question for Dr. Dobbs. You mentioned that there's been a significant and dramatic shift in the demographics that we're seeing impacted by the virus during this surge. The first wave, it was hitting a lot of African American Mississippians, and this wave, white Mississippians seem to be more impacted. Are there certain types of social gatherings or reasons that you can point to for this increase in cases and deaths in white Mississippians specifically? Why is this happening?
The what is easier to describe. We have seen a pretty significant shift from African Americans to Caucasian folks in Mississippi. Even the per capita death rate over recent weeks is higher in Caucasians than in African Americans. That's been a pretty significant shift over time. I'll just say we've had a lot more receptive communities. The African Americans understand it. I think they had a lot of trouble. A lot of them have family members who've had it or have died. And so with the masking and the social distancing, anecdotally, I feel like the message is a lot more well received, eagerly. And I think, and if I go places, I see that African Americans are more compliant with the masks, just to be quite honest. But I think it's also a message that what works, and we know that you can turn it around, and it's simple stuff. It's not shutting down businesses. It's not doing extreme draconian things. It's a little bit of space, a mask when you're in public, and then having small groups and not doing social stuff. What we've seen also is in the schools, and a lot of the schools that have really been driving it, it's been social events. And a lot of it's parent-sponsored social events, and a lot of it's athletic stuff. So I just think that there's a lot of room for improvement.
Nick Juden with Jackson Free Press has a question.
Hi, yes. So anticipating the danger to the hospital system, it's my understanding that though there are many risks, personnel is the biggest limiter for our capacity. And of that personnel, the nursing shortage is the most dire. Can you speak about that shortage, what it means if we exceed our supply of registered nurses in Mississippi, and what emergency measures we have available at that time?
Yeah, yes.
Well, no, that's the million-dollar question, right? We're all in the whole country pulling on that same resource at the same time. So there is a limited supply, especially for the critical care nurses, because even within every field, there's subspecialization. So what we're going to look at is really stressing out our core staff. They've been working really, really hard, and they deserve our thanks. We have a limited supply capacity to sort of bring in new folks, but there's a training element, and there's an issue of making sure they're up to speed. And we're trying to work with nursing schools to bring in more supply. We're not going to be able to recruit nurses from other states. That's just not going to happen. And just to be honest, we're probably going to near about work them to death going through the next month or so. And so, say thank you to a nurse. There's no easy answer to this. There's no easy way to do it. Same thing, respiratory therapists and other folks are very busy. The one bright side of it is we do seem to have a better grasp of management of folks early in the course of illness. We do have some treatments that are available. Once people go in the hospital, the likelihood of them going to the ICU seems a little bit less. We know that the mortality rate in hospital has dropped. Looking at our data from the first 6 months, the in-hospital mortality rate was about 16%, right? So if you went in the hospital with COVID, 16% chance you were going to die on average. Based on other sort of studies, it looks like that could be better with some of the steroids and other treatments, but it looks like it's still going to be about 11%, 10%. But that's a significant drop, but still a pretty high risk of death, for a lot of our populations.
Yeah, I think it is important that with the therapeutics, with better treatments, we've learned a lot on how to treat patients with the coronavirus, and I think that is obviously borne out by the data. If you look at total hospitalizations right now relative to where we were at our peak, we're about 18% below where we were at our peak. But if you look at ICU patients that are in the ICU beds, we're actually 33% below where we were at our peak. And if you look at those individuals on a ventilator, we're actually about 40 to 42% below where we were at our peak. I think that to a certain extent speaks to the fact that we have learned a lot about the virus and we're just better at treating it. And I think that's a positive thing. Now, these numbers are likely to go up some in the coming days and week. I don't think there's any doubt about that. If we don't see a rolling over of the total number of cases, but we are seeing certainly better treatments. The University of Mississippi Medical Center, and this is when I hear about the fact that that there are risks in terms of personnel. There's no question about that. But we also have to be realistic. There are currently 14 patients at the University of Mississippi Medical Center in an ICU bed because of COVID. So let's just keep that in mind. Yes, sir.
Governor, what did you learn, that you may have not known or paid attention to dealing with your own situation with your daughter having COVID-19? Take a moment to speak to Mississippians about being on the other side of that, perhaps someone who doubts it or considers it mute.
Yeah, I don't know that I would say that I learned a lot because I took the virus very seriously before my daughter tested positive. But it's certainly, by its definition and by its very nature, when it's someone that you are very, very close to, it's just a different level. And I think the fact is, and Dr. Dobbs mentioned this in terms of how certain groups are reacting to the virus. I don't think there's any doubt that if you know someone personally that has suffered with the virus, or if you know someone personally that has been in the hospital with the virus, or if you know someone personally that has been on a ventilator with the virus, or sadly, if you know someone personally that has passed away because of the virus, it is very possible and maybe even likely and maybe even understandable that you react a little bit differently than those individuals that do not. And so there's no doubt that when you look at my personal situation, there were a number of very young kids who had it, that got it, that did not have significant symptoms, but that they did carry the virus and they did give it to people, and in some instances gave it to each other. And so my point in all of this is to my fellow Mississippians: this thing is real, and it generally, as we've said since the beginning, doesn't treat young people really, really bad. Doesn't treat middle-aged people that bad typically if you're in good health. But it's really bad if you're over the age of 65. The mortality rate is at a level that is tremendously high, and that's why we are trying to stress so much the need to be careful during Thanksgiving, because young people and middle-aged people and people who are neither one of those but are a little bit older tend to get together during Thanksgiving, and that's a high-risk scenario.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Governor. Thank you, Bailey. I've got two questions and then a follow-up from the Governor. Two of the questions would be the first one for Dr. Dobbs, the second one for Director Michelle. The first one, Dr. Dobbs, would be, the question is Regeneron or the vaccine more than likely to come first, and how that would be distributed? And the second one for you, Director Michelle, would be, being from Harrison County, obviously you know the amount of damage from Hurricane Zeta and from the FEMA and NEMA things that are the assessments that are trying to happen. Because of, there's a likelihood of the change in the White House. Is that going to be a difference between the agencies and the timeline distributions of money? And then I have a follow-up with you, Governor.
Yeah, thank you for the question. The Regeneron antibody product is almost certainly going to be available before the vaccine. We should be having that allocated within this week. So we've already had allocations of the bamlanivimab, the Eli Lilly product, and it'll go initially to hospitals for utilization in health systems based on their case burdens where they are. And then we're working to let private clinics that have the capacity are now signing up to have access, and nursing homes too can sign up to get this for their folks, which is a great utilization. I think that's everything.
Hunter, to your question on the federal declaration, I mean, clearly there's always a potential for something to be slowed down during a transition like this, but I will tell you that my recovery director has had communications with FEMA. Everything thus far is moving along on track. We had 30 days to get this request in. We had the option to request an extension to get these damage assessments in. We brought in additional people. We're not going to have to do that. Probably more concerning than anything else is going to be that this is a holiday season, so people are going to be taking off, spending time, and taking some time off, so that it will likely have some delay in the process. But I don't anticipate any issues. We should get a response back, hopefully sometime after Christmas on this declaration, if not before. And then as soon as that declaration is made, the counties and municipalities can then begin to make application to this declaration, begin to put in their project work statements, and then from there, we should see reimbursements coming sometime, after the first of the year at some point. So I'm not concerned about it at this point, no.
Hunter, I think, had a follow-up, or,
Yes, Governor, thank you. The one question is, because I remember you spoke pretty clearly about it at the start, about the difference between Pfizer and Moderna having access to the vaccines. One question would be, would these need to be from the same drug company, Pfizer and Moderna, the different vaccines, or would this have to be a separate, the 3-week difference between taking both?
again, I'm not a medical expert, but I would presume if you get the first, I think you should stick with the same company.
That's correct. If you get the Pfizer, you need the Pfizer, the second dose. The same thing with the Moderna product. Yes, sir.
Yes, sir.
Curious on the vaccines, how is that going to be distributed? Is it, you have to pay through your health care plan? Is it going to be limited cost? Do y'all know the answer to those questions?
Yes, we
Yes.
have made those decisions.
Yes. So there will be a tiered distribution, like there's phases, and the current scenario is such that it'll be tiered out primarily to healthcare folks and first responders as the first allocation. It'll be free. And then as it goes through to then the higher risk folks, especially like long-term care, nursing home, that sort of thing. And then once it reaches general population, that's going to be the real issue. And, it looks like the vaccine will be provided free of charge, but there'll be like an administration fee that you can charge insurance once it starts going to pharmacies and clinics, but also too, we'll have our public health distribution network, such that people don't have insurance and stuff, they can still get it without any charge.
So people just off the street say doesn't have a health care plan, they have a good shot, they won't have to pay anything for the vaccine?
Absolutely. We'll make sure they get it. Yes, sir.
Yeah, and that's a big piece of Operation Warp Speed. The significant amounts of federal taxpayer dollars were utilized to not only help subsidize the research for these vaccines, but also to initiate the manufacturing of those vaccines, so that they literally have manufactured large numbers of doses, not even knowing that it was going to have an efficacy rate of 95%. In fact, I heard Dr. Fauci say, if I heard him say it once, I heard him say it 10 times, that if it was 70% efficacy rate, that they would be pleased. And so where we find ourselves is actually quite good. Yes.
Keisha Rowe with the Clarion Ledger has a question.
Good.
Good afternoon, everybody. These are a couple of separate questions for Dr. Dobbs, if I could. In terms of the vaccine distribution, how many doses are expected for phase 1A? And if there aren't enough to cover all of the frontline workers in the state, how will you determine which frontline workers will receive those first?
So the 1A would eventually get all the healthcare workers and first responders, but our first distribution is likely going to be less than 30,000, so entirely inadequate for the entire group. But it'll start coming in different allotments. We do have some data on which healthcare workers are at highest risk of exposure, and we will work with the different health systems through their closed points of dispensing to do it. It'll be some of the decision on the day-to-day will be from the local health systems to help prioritize it, but we'll give it to them to start with, and then but it'll be sort of like a staggered sort of release as more and more is made available to us.
And they literally, and this was made very clear on the call yesterday, they literally, once emergency authorization is approved, they are literally going to ship vaccines the very next day. And so if it's approved on December the 10th, they're going to ship on December the 11th. And so the first initial amount will come out relatively quickly. If in fact they are correct in their analysis that 37.5 million doses will be distributed by the end of December, and I think that's optimistic, by the way, but if they're right, our per population amount that we should receive by the end of December is 375,000 doses. Again, I think that's optimistic, but we could see significant numbers coming out very, very quickly once the approval is done.
I did. So I wonder if you have any estimation of how many providers have signed up to distribute the vaccine through the vaccination program provider agreements, and whether or not the state has enough funding in order to distribute the vaccine statewide.
I don't have an update on the number of providers who have signed up. I think there were 60 or so in the queue when I checked over the weekend, so I can get an update for that. But we will continue to accept those. Now keep in mind, the general provider provision of vaccine probably is not going to be for several months. We're going to be working through the phase 1A, 1B probably over the next month or two. So that's something that's kind of in progress. And then as far as funding, we will need additional funding to support our vaccination effort. I think we've estimated for the state of Mississippi, we would probably need about $30 million to pull it off altogether for the entire kit and caboodle. So, but we do anticipate, and we've been working with our federal groups for federal support, but we've also been very fortunate to have access to support from the Stafford Act and other sources. We have every confidence that we'll be able to pull it off.
Bobby Harrison from Mississippi Today has a question.
Governor, I apologize because you kind of answered this already, but I just want to get you on the record in terms of the mask mandate, and as it relates to a statewide mandate. You have the heads of University Medical Center, State Medical Association, and other medical groups asking for a statewide mask mandate because they say their healthcare systems are being overwhelmed. They're having to transfer people out of state. Can you just address that issue? Thank you.
Yeah, well, thank you, Bobby, for that question. And there's no doubt that I've been getting a lot of advice through public domain from a lot of different people on what we as a state should do and what should work. So let me be clear. I believe that the more people who wear a mask, the less likely we are going to see continued increases in numbers. Said differently, the more people who wear a mask, the better it is for Mississippi as a whole. The question then becomes, how do we encourage and find more and more people actually participating in the wearing of masks? There are some, and I think they're completely wrong, that believe that the way in which to do that is for a statewide elected official to simply write on a piece of paper, statewide mask mandate, and all is good. The problem is, Bobby, that the data does not support that. And here's what I mean when I say that. Let's look at some of our neighboring states. Mississippi, just for comparison purposes, our 7-day average of new cases is 1,283. 1,283. That, by the way, is a number that I did not include today's number of 665 in. I started before the 665 because we all know that that is probably arbitrarily low, much like the Saturday number was arbitrarily high because these things fluctuate. So just like I didn't personally get panicked on Saturday, I didn't throw a celebration today. Now, I noticed that many of you had front page articles about the big number on Saturday, but didn't spend a lot of time on the small number today, but that's okay. But for comparison purposes, Mississippi, 1,283 cases. Now, relative to where we were in August, that's slightly below our peak, but it's still a high number compared to where we were throughout this entire process. But if the question is a statewide mask mandate, those three words, the buzzword as it has become, because we all want to blame somebody else, right? We all want to find someone to blame for why we find ourselves in this position. The reality is the only somebody to blame is the fact that the virus is very contagious. And so, but let's look at some of the numbers. The state of Kansas is slightly smaller in population than is Mississippi. Not by much, but by a few. Their 7-day average is 2,000 810. Their governor instituted a statewide mask mandate on July the 2nd. Let's look at the state of Kentucky. Their 7-day average is 3,020 daily cases. Now, they have about 1.4 times the number of people that we have. Their governor, a Democrat, issued a statewide mask mandate and left it in place on July the 9th. Let's look at some of the states around us. The state of Arkansas, approximately the same size as us, their 7-day average is 1,734, approximately 50% greater than ours. Their governor had a statewide mask mandate put in place on July the 16th. Has not taken it off since then. The state of Alabama, their 7-day daily average, 2,785. Governor Ivey, a good friend of mine, by the way, issued a statewide mask mandate on July the 16th. Their total daily cases 2.5 times what ours are. Let's look at the state of Louisiana. Governor Edwards issued a statewide mask mandate on July the 11th. Their 7-day moving average, 1,964 cases, compared again to our 1,283, approximately 60% higher than ours. The state of Tennessee, just to our north, 4,395 cases on a 7-day moving average. That's daily cases. State of Louisiana, by the way, Governor Edwards put his statewide mask mandate, the buzzword, the 3 words that are supposed to stop everything and slow everything down. He put his statewide mask mandate in place on July the 11th and has not removed it. So just for summary, and before I go to a summary, let's talk about the state of Indiana. The state of Indiana is a state of 6.7 million people, almost twice our size. State of Indiana's 7-day daily average, 6,310 cases per day. Their governor had a statewide mask mandate that they've had in place now since July the 27th. So as a summary, Mississippi, because some of you are saying, well, you're using all these states that have a big population, and so it's not fair. You're not comparing apples to apples. So let's compare apples to apples. 7-day daily average per 100,000 residents. Mississippi is 33rd per capita in the nation. Mississippi, by the way, has the 6th least restrictions of all 50 states. In other words, 44 other states around this nation are more restrictive. Some of them have closed small businesses, they've closed restaurants, they've closed bars, they do mask mandates. They've got 44 other states that are more restrictive than is our state. Mississippi's per capita number is 33rd amongst the 50 states. For comparison purposes, Louisiana, statewide mask mandate July 11th, they're 21st. Arkansas, their statewide mask mandate July the 16th, they're 26th. Kentucky, their statewide mask mandate July the 9th, they're 24th per capita. Indiana, their statewide mask mandate July the 27th, they're 11th per capita in the total number of cases. Kansas, their statewide mask mandate July the 2nd, they're 12th per capita. Again, Mississippi is 33rd. We now have the 32nd most cases in aggregate amongst all 50 states. In August, we were in the mid-teens. I tell you all of these numbers not to say that this state is getting it right or that state is getting it wrong, because I don't know all the factors that go into the decisions that have been made. And we all know that we're all making decisions based upon an ever-changing environment. But I get frustrated when so-called experts decide that if we just did one more thing, that we could change this. The fact is as follows. There is no one silver bullet. There is no one thing that we can do as a state. There is no one thing that I as a leader or that we as Mississippians can do to make this go away. This is a highly contagious virus. For those over the age of 65, it is exceptionally deadly. But here's what we can do. And it don't matter if you're in Indiana or Kentucky, Kansas or Louisiana or Arkansas or Tennessee or Alabama or Mississippi. It don't matter if you're a Republican or a Democrat. It doesn't matter if you live in a rural area or an urban area. If you will be aware of your surroundings, if you will wear a mask, if you will stay socially distanced from your fellow Mississippians, or in other states' cases, your fellow men and women that you live with and around, if you will do less social stuff, and when you do social stuff, do it in significantly smaller numbers, we can, as a group, collectively, at the margin, reduce the total number of cases. We're not going to eliminate the number of cases until the vaccine is massively distributed to the masses. But I appreciate all of the advice I get, and for those of you that need a little entertainment tonight, just go on any of my social media platforms and you can find that I get lots and lots of advice from lots and lots of well-meaning individuals. But the data doesn't lie. The fact is that Mississippi, while in a much worse position than we want to be in, is in much better shape relative to most every other state around the country. There are 40 states that have statewide mask mandates. I have shown that when I believe it is in the best interest of our state to determine the best outcomes, I will sign an order to that effect. But what I'm telling you is, in spite of what you may have heard, what we are doing is working better than what's not working throughout this country. The fact is, these increases in numbers are happening all around the country. It's one of the more troubling things is, as bad as things were in March or in April in the Northeast, at least we had other places where things were not as bad, and so we could move resources as a country. The troubling thing today is we're all struggling with it. Now, we're 33rd per capita, but we're still in a position that puts us in where we have challenges. But I just want to make sure everyone understands that the way we make a difference is by all of us stepping up and doing a lot of those little things, because there is no one panacea to solve this.
Nick Juden with Jackson Fruit Grass has another question.
Governor, I understand your philosophy on the limitations of mask mandate. I understand the data that you're looking at. I understand the opposing argument that different states have different relationships to geographic outbreaks. And if you compare Mississippi to Mississippi, the statewide mask mandate period is the only period of dramatic, sharp decline. Here's my question. If you don't trust the, as you call them, so-called experts who tell you that mask mandates do work, who are the experts you do trust? What Mississippi public health professional is telling you, please, no statewide mask mandate?
Well, Nick, I appreciate your question, and I appreciate your advocacy for your positions. Here is the fact. I'm going to make decisions based upon what I believe is going to provide the best outcomes for the most number of Mississippians. And because of that, what you are seeing is that in numerous counties in which the mask mandates are in place, we're seeing significantly better participation by our fellow Mississippians. We are seeing more masks being worn, both from an anecdotal standpoint and quantitative. It is not universal. We have some leaders in some communities who, for whatever reason, don't think that masks work. I think the data is very clear. I think the data is very clear that our approach can and will lead to the best outcomes. If, in fact, you look at the time period in late June, all of July, and August, we actually had turned over the curve in our state well before the statewide mask mandate was put in place. The statewide mask mandate certainly, because of the seriousness that our fellow Mississippians took that particular issue, we saw a large number of our fellow Mississippians wearing masks, of staying socially distanced. And as we've said, just quite frankly, if you will assume that everyone that you're around has the virus and act accordingly, it'll go a long way towards helping us slow the spread.
Dr. Dobbs, have you given what you've seen in the data, given the fact that we're heading to Thanksgiving, have you recommended at any point in recent weeks the statewide mask mandate? Has it been in your mind at a point, given the data, that you would like to see that?
I certainly advocate for masks and think that it's an important part of it. Obviously, a lot of it's local, and we see different engagement locally. So, I understand the governor's argument, and I think it has to be embraced locally. So, I totally get that. But one of the things I just do want to reiterate, with the mask mandate in the order, it's not just the masks, it's the social distancing piece, and we don't talk about that. I would like for everybody to make sure that we understand that along with that order are restrictions on the number of people who can get together indoors. And if we look what's driving transmission right now, it's groups of people indoors. And I would like to change our conversation a little bit to that, just understanding how important that is, because we're not going to wear a mask while we're eating, and we're not going to wear masks around our family. So we really have to do those other things that are going to work.
Obviously, if you limit the size of your group, if one in the group has the virus, you are by definition limiting the number of people around you that you can give it to. Yes.
Keisha Rowley from Clearing Ledger has another question.
This question actually is for both Dr. Dobbs and Governor Reeves. And back to the virus distribution question, what are the biggest hurdles that you guys have encountered so far, and what are your biggest concerns as we kind of get closer to the time when it will actually start going out?
I'll let Dr. Dobbs take this by and large, but one of my biggest concerns is individuals' willingness to take the vaccine.
Yeah, there's a lot of moving parts to it. This is an enormous logistic task. So the planning piece has been absolutely huge. IT systems are going to be very important, making sure they're integrated. I think that's going to be one of our biggest challenges. Along with our MEMA partners and National Guard, we've been running a remarkable logistic machinery, and I think we can do that. Money and IT stuff, I think, are going to be our biggest challenges. Certainly, we have that ultra cold issue with the Pfizer vaccine, but I think we have a good plan that's going to help. And as we add additional vaccine into the mix, that's going to be super, super important. And then we also need for people to be patient, so that when it's the right time for them to get the vaccine, they can get it. It's going to be a pretty orderly phasing of vaccine distribution based on people who are likely to be exposed, preserving health care, and protecting the vulnerable. So we're seeing growing demand. I'm getting a lot more inquiries about, hey, I want a vaccine, when can I get it? from all parts of the population. So I do think there's going to be demand as we're seeing more data come out, and I think as we get more data from FDA and from CDC, I suspect that demand is going to be considerable.
Yeah, I think to a certain extent, in our state, we've seen significantly higher demand for testing as the number of cases rose. I think we probably are seeing significantly higher demand for the vaccine today because more and more people know somebody close to them that actually have tested positive for the virus.
Governor,
Gerald?
as you've talked about the need for the state and the federal government to work together as these vaccines roll out, are you hopeful that you will talk with President-elect Joe Biden and his team?
Well, we're certainly going to work very closely with the administration on the distribution of the vaccine. The reality is that as we listen to the leadership of Operation Warp Speed, it is the men and women of the United States military that are overseeing the vast majority of this, and I don't think they care who the commander-in-chief is. They're going to do their duty to get this vaccine distributed, and we're going to work with whomever to make sure that our people are taken care of and protected. Yes, sir.
Is there anything the state can or should be doing as you plan for the vaccine rollout to address Governor Reeves' that concern of individuals' willingness to take it? There's a lot of skepticism out there. Is that something you guys are planning for? Is there anything you can do you think, messaging-wise, to combat that?
Well, what I would tell you is, and Dr. Dobbs and I have had many conversations surrounding this, once this vaccine gets through the authorization process, I am personally confident that the number of individuals involved in the development, in the clinical trials, in the approval process, and in the peer review is such that, quite honestly, this particular vaccine will have gone, while it will have been done faster, if you look at the total number of patients, et cetera, the reality is that this vaccine is going to be as safe and in many instances significantly more well studied than other medicines that you and I take regularly. One challenge that I just want to point out, one challenge is that there are going to be 2 doses, at least for the Moderna and the Pfizer. So let's remember that. So if you just get the first dose, that ain't enough. You need to get both. The other challenge that I see with respect to this particular vaccine is just the mere fact that we don't yet know for sure how long the vaccine is good for. Because what we know is we've had tens of thousands of individuals of all races, of all backgrounds that have gone through this, but because it has been expedited, we know that it's good for 2.5 months, because that's how long the trials have been going on, but we don't know if it's good for 6 months or a year, and so that's one of the things that, at least from my perspective, we've got to figure out over time.
And very intentionally, we haven't been promoting the safety or efficacy because we don't know, right? And even now, we don't know for sure. So we're being cautious. If we want to be honest and trustworthy brokers, we need to be critical, analyze it critically ourselves. So that's what we plan to do. What we have been doing is we've been doing outreach to different groups, different leaders, political and otherwise, faith leaders, et cetera, going over how do vaccines work, what is the process for the vaccine development, what are these new vaccines that are being produced and how are they made, to better understand the foundational science. And if you want to see some of the presentations that we did, there's one that we did for the Hospital Association that's on our website on the immunization page, and you can see some of the information that we've shared with them, and there's like a YouTube video.
Yeah, so to summarize, we have multiple companies that have done trials. They say the efficacy rate is approximately 95%. Now you'll have the FDA, you'll have peer group review, and then, of course, Dr. Dobbs and his team will review it as well. And so that piece has not taken place yet. It is in the process because now the data is coming out because they've actually filed their emergency authorization before them, and so we'll get that data. And I think there's clearly an adequate number of individuals who clearly want the vaccine to work, but they're not going to approve it unless the data actually says what they say it says.
If I'm correct, Dr. Dobbs, wasn't Forest General posting some of the volunteers who were being tested? Did you ever get a reaction from their administration or from their folks with regards to how those volunteers took, whether they received placebos or actually received the vaccines?
Yes, Forest General Hattiesburg Clinic, I think, were involved in the Moderna trial, and still are. They won't know. That's part of the trial works. They don't tell the study sites if they're getting the placebo or the real vaccine. But I feel very confident that there was a mixture of both down there. So that's part of the blinding process, so there can't be any bias in observation, that even the study folks don't know who gets what.
Well, we have been here for an hour and a half, and I think it's been a good conversation, a good discussion. I think it's been important that the people of Mississippi recognize that we have had a very challenging couple of weeks with rising cases, and so that being the case, we need to all be very careful going into Thanksgiving Day, that we minimize the number of people around, that we can do it more safe by doing it outdoors, and I just hope and pray that everyone will be safe, because we want all of our fellow Mississippians to avoid what is a very, very challenging virus. So for all of you, please, happy Thanksgiving, stay safe, be careful, and God bless.